A nationwide nursing shortage is impacting hospitals here in the Valley, but officials say it's nothing new, saying they've been dealing with staffing concerns for years, well before the COVID-19 pandemic.
Valley News Team's crime and safety reporter Bailey Hurley spoke to both Sanford and Essentia about where they're seeing the shortage most and how it's impacting patient care.
While Sanford Health says the staffing crisis started long before the pandemic, there's no denying COVID's impact. For one thing, many nurses have retired or left the field altogether.
Of course, losing that experience is tough because we need those experienced individuals to really help and train the new ones that are coming in.
But at the same time, Larson says the pandemic has also inspired many people to decide to pursue a career in healthcare. For Sanford, Larson says their most significant staffing impacts are seen in the emergency room, ambulance services, and inpatient care, adding they're also seeing a shortage of phlebotomists and respiratory therapists for the first time.
The demand and the volume that's coming in that is really significantly higher than we've seen in the past.
Larson says the shortage does impact the hospital's ER wait times, but says the time and day of the week also play a large role in how long a patient may have to wait.
I think one of the challenges is the volume is staying higher day by day, so then we do see some of the waits in the ER go up with that.
Meanwhile, across the street at Essentia Health, Nicole Christensen says it's not the ER where they're feeling the hurt. Rather, she says both operating room and critical care nurses are the most impacted.
I wouldn't say it's out of this world high, but it is at a concerning level that we are monitoring every single day.
Christensen says Essentia averages around 30 to 40 vacancies, which they try to combat with monetary incentives and specials to get others to pick up shifts, something Sanford Health says they do too. But as Larson points out, it's all a balancing act.
Because I think you can offer a lot of incentive to get people to work, but that doesn't mean that they're not tired, and we need to figure out a way to make sure that their well-being is at the top of the list.
Both say a large amount of international and traveling nurses play a vital role in helping keep the ship afloat, both emphasizing while their hospitals are shorter on staff, patient care is and will always be the top priority. Bailey Hurley, Valley News Live.
In an effort to combat those shortages, Sanford is hosting a hiring fair next Tuesday, July 20th at the Delta Hotel. All are welcome.